Hello, and welcome to the 27 Degree with Chris and Nancy. Our guest today is Dr. Joseph Spirito, here to discuss medical marijuana licenses. Before we begin our conversation, I'd like to thank our sponsor, Bay Coast Bank. Bay Coast Bank is just right for all of your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. As always, you can support the 27 Degree with Chris and Nancy by signing up as a patron. Go to patron.podbean.com/the27degree, or you can click on the link on our Facebook page. $5 per month gets you a shout out, bonus content, access to Basement Bites, Chris's music videos, and a behind the scenes look at taping before and after the show. You can find the 27 Degree across social media, including Facebook, Instagram, and your favorite podcast platform. You can also subscribe to the 27 Degree Consulting channel on YouTube. As always, a big thanks to Ron Gamache for our intro music and EBM Studios for producing our show. So, Dr. Spirito, great to have you here. Thank you
very much.
Welcome.
Thanks for having me.
We've known each other a long time. I was really pleased that you were able to come on the show. It's just wonderful. Tell us a little bit about yourself.
I am a board certified internal medicine physician and also board certified for hospice and palliative care. And I practice primary care here in Fall River.
Excellent. Great.
How did you get involved with the medical marijuana license?
That's always a question.
I know.
Always.
I know.
Patients are using it.
Yeah.
That's the primary reason. What I found in my younger population, and I'm sure Dr. Jonkis will agree, they would come in with a condition that I would write a prescription for, and then when I would have them back to the office, how did it work? Did it help you? I stopped after 2 doses. I don't want a pharmaceutical. I felt funny on it.
So you're talking about opioid type prescriptions?
Opioid, even antidepressants, anti-anxiety medications, okay. And the younger crowd weren't using it. And on one particular day, I said to 2 of the patients, I said, well, what do you do to handle this? It was anxiety, actually. And they said, well, we just smoke marijuana. Mm-hmm. And I didn't think much of it. And when I went home that night, the first story on the news was that they found tainted marijuana on the streets in Fall River. Mm-hmm. And of course, there was a program in Massachusetts. And I said, well, why, if they're going to use anyway, wouldn't we offer them what is known to be, high grade quality? They're going to get relief with it. And then I can actually offer them an opportunity to use something other than smoking it. Because
something that is safe. Right.
Right.
I had a similar experience in my practice, and we have, of course, very similar backgrounds. Right. We're both in primary care, hospice and palliative care, certified, and do a lot of work in that space. But I didn't really know much about CBD or marijuana. And then I had patients who had come in who were on chronic opioids, who on their own had started to use marijuana to improve their chronic pain. And a number of them were able to, on their own, taper down their opioids, which I was quite impressed by, because you don't see that often. And then I, as you know, got into into CBD, right. And which is, of course, it's all related. But as you mentioned, I've also had an issue where there have been a number of patients who are on a chronic pain regimen, also use marijuana to supplement their pain control, and we're buying it off the street, and then we're finding that their drug tests were positive for things that they assured me they were not using. And most of these patients I had known for a long time, and I did believe.
Sure.
And then I sent them to get their license. They started getting it from dispensary, and their drug tests after that came back negative for those other substances, usually cocaine.
Right.
Because a lot of the marijuana out on the street is laced with other drugs, cocaine, fentanyl, whatever.
3 cases this year that were the same, positive for cocaine.
Right.
So you just said that you had written a license too. Does a doctor have to have anything like a special
I didn't write a license. No, I sent them for the license.
Okay. I'm sorry, I misunderstood
I don't do that.
So what did you have to do to be is it certified to,
So,
to write
Right,
licenses?
you apply through the state to become a certified physician, then there's some CME requirements, and then obviously a lot of self-education. And then it's been really just a patient experience that I've had with them, in terms of the input from how they've done with it. And I know it's all anecdotal, but they've done really well,
Right.
for a lot of medical conditions. So.
Now, what kind? You just said a lot of medical conditions. You led right into my
I
next
did,
question.
like
Thank you so
meatball.
much.
Had to hit it.
Exactly. I like that.
That was all planned out, right?
So, what are the medical conditions?
So it varies from state to state, obviously.
Oh, there's requirements for it. Like
Right,
you have
each
to fall
state
within a category.
will list a group of medical conditions that they certify for. And there's a little bit of a variance between states, so let's just focus on Massachusetts. Similarly to other states, they will certify for conditions like glaucoma, history of cancer of any kind, whether it's currently being treated or in the past, hepatitis C, HIV, AIDS, chronic pain, or any other debilitating conditions that would interfere on a day-by-day basis with the patient's life. Conditions like Parkinson's, ALS, multiple sclerosis, seizures. It's a long list. PTSD, and in Massachusetts, actually anxiety, depression, and insomnia.
Why glaucoma?
There have been some reports that it helps decrease the pressure. So
Oh.
they've included that as one of the conditions. Most states will include glaucoma.
So now, when someone comes to you and say they're totally naive with this stuff and just say, "Listen, my son uses it. He says it's like works great."
Right.
Are there any other precautions you have to take?
So that's probably the most common scenario that I see in patients that have never used it at all.
Right.
They are complaining of conditions at home that they're not getting relief for. A family member or friend says, "Hey, I get relief for the same condition with this. Why don't you try it?" And then they do so well with it that they end up wanting to get a license.
Okay.
So that's the most common thing. What I tell those patients who are very apprehensive about using it is we start low and go slow. It's kind of the best policy.
Yep,
right?
always.
So,
What's the most common form that your patients use? Is it like the gummies, or are they
so
smoking?
despite my asking them never to smoke anything at all,
Yeah, it is.
smoking it is probably the most common, only because it's cheaper. Financially, it's advantageous for them. If they use the topicals or the edibles, they tend to be a little more pricey.
There's also differences in the time course as to how it affects them too. And it may be that some people like that immediate response they get with smoking versus the gummies, which can take an hour or more to kick in.
Sure.
Yeah, but I agree with you. If we can not smoke, it's always best, because we do know that this can cause damage to our lungs, just as tobacco does.
So it's similar to cigarettes, like the risks kind of with the smoking.
You may know more about the risks for COPD, lung cancer, and that I don't know the actual statistics. I know that there is still risk. I don't know if how it compares though.
So the interesting part of this whole field is that the data is still emerging, right? There haven't been studies up to this point to any degree, and there had been some studies that had suggested that maybe cannabis smoke did not have the same effects that tobacco smoke had on the underlying lung tissue. I don't know that ever panned out, but I think in general, most consensus is that at the very least, it's going to have the same toxins or the same effect on the lung tissue, the same bronchitis, cough. So in general, I think the main consensus is just don't smoke the product.
Yeah, I looked this up the other day, and I found a number of varying reports. Some said it was worse than tobacco. Some said it was better than tobacco. It's all over the place. And I just think there haven't been the studies in the U.S. I mean, where this hasn't really been a federally legal substance, it's hard to get money for good research.
Sure.
I know there's research that's going on in other countries. I know Israel does a lot of research, and Europe has done research, but in the U.S. there's not as much that's been done. So
I think we'll get there.
We'll get there. I think we will too. But I mean, it makes sense that any irritant, anything you put into your lungs, it is going to have a negative effect.
Right.
Per se.
When you have that discussion with the patients, like if if you've tried something and it hasn't worked, as far as anti-anxiety meds or what have you, how do you begin that discussion with, hey, let's take a look at this. Are you interested? And like, how do you say these are the pros, these are the cons? What's that discussion sound like?
So one of the first things I say is, don't look at me like I have 3 heads when I bring this up. I really do, because it's not something that patients are going to expect the physician to talk to them about.
Right.
But the other thing I tell them is I like to put everything on the table.
Yeah.
Just because I'm putting it on the table doesn't mean it's right for you.
Right.
And it doesn't mean it's going to work. But how can you make an educated decision unless you have all the options in front of you?
Right.
And you think about them. So we go from A to Z, and that will often be on the table, because I don't know about you, Chris, but I would prefer to use this for patients with anxiety and insomnia over benzodiazepines.
Absolutely.
And so, that'll be on the table, and we talk about the pros and cons of each. But surprisingly, what I'm finding lately is that most patients have had enough knowledge from friends and family that they've actually been thinking about it for a while.
Especially now that it's legal.
Yeah, I mean, do you find this? I find that when I do bring it up, because I'll bring it up often as an alternate option for pain control or for whatever condition they're suffering from. A lot of patients are actually relieved. They and I start the conversation sometimes like that too. I'll say, look, I don't want you to think that this is an unusual thing that I'm bringing up as a physician, because I know often it's not brought up, but I want to let you know all the options that are out there. And many patients are really happy that it's brought up, because they want to ask about it. They're afraid to ask about it. They don't know what you'll think of them. Will you be judged, etc.
Absolutely.
So now when you have a patient who you have that conversation with, how do you just send them to Dr. Spirito?
So I have my conversations is a little more. I also talk about other things like CBD too, because as you know, I'm very much interested in the CBD space. So I'll talk about medical marijuana. I'll talk about CBD as an option. And then based on what they're interested in, then I can make a recommendation. If they are interested in medical marijuana, I can send them over to Dr. Spirito. If they're interested in CBD, then we can do something different.
Sure. Now, what happens like if someone's in chronic pain? I had an injury to my arm last year, and it's horrible. And I'm on some pain medication. How do you balance that? Like, what are those kind of recommendations?
Look, my experience has been similar in that they are able to, one of the benefits is that they're able to utilize medical cannabis and not have to increase the dosages of the medications that they're on currently. And some have actually been able to stay where they are or reduce them. So I use it as an adjunct. I mean, there's topicals that they can use often for, localized pain.
So when you add this in, like if they're on certain pain medication dosing every day, they don't have to like decrease it before they try it, or they just try it and then they kind of figure out where they are with it. Right. And then if they can cut down and feel like they're in a comfortable spot, they do so.
It's nice to see so many people that come in and actually say, I'm in a pain program. And there's 2 things that have been happening. The pain program has recommended they get their license because they know they're using and they want them to have a license.
Nice.
And the second thing is they really, truly want to come down off of some of these medications. And so they ask about that. They're like, my interest in getting on or using medical cannabis is to help me get off these medications.
Do you find that the pain specialists have kind of come along over the last couple of years? Because I remember years ago, if someone had a drug test positive for marijuana, they'd be like, oh, we can't give you any opioids. And I don't see that anymore.
No, I don't see that anymore either. Matter of fact, when they see that, they're now asking the patient to get a license.
Yeah. So and I'll put this to both of you. Like, what's the benefit of decreasing your pain medication and going on medical marijuana?
That's a good question.
God, there's so many. Well, first of all, you're not going to overdose from marijuana,
right? Course.
Okay, we have an epidemic in this country where people overdose from opioids all the time, and a lot of this is unintentional. And they use opioids. Sometimes they're on the same dose, and then something else gets introduced into their system, whether it be a benzodiazepine, such as Ativan, Valium, clonazepam, or maybe alcohol or something that is a depressant, and they overdose unintentionally. So, we want to get people to get away from opioids as much as we can. We know that we can't be an opioid-free society because there are painful conditions that require this medication,
Right.
and it is a medication. But we want to reduce the level to the lowest useful level for each patient so that their risk of overdose is lower. Would you say that's
top 3 for me? I mean,
yeah,
I think
that's the main reason.
So now we have a large mental health concern and population that we're looking at, and some of this population are on some heavy hitter medications. So are there contraindications? Like, can you introduce this into someone that is maybe on multiple meds but is still feeling like a lot of anxiety? Or
You can, and that's one of the benefits, I think, is that it can work as an adjunct to the current therapy that they're already on. I mean, obviously you have to be careful with certain mental conditions like personality disorders or any conditions with psychosis. But yeah, and many of them, like I said, have been using it previously, so that they come to you.
Yeah.
They're not naive.
Right.
They've come to you with years history of using.
I mean, there are certain conditions I probably wouldn't recommend it to. If someone was a paranoid schizophrenic, I would not recommend this because it could potentially exacerbate some symptoms that they may experience with their condition. And I've had a few patients who are paranoid schizophrenics who had exacerbations because they went out and used recreational marijuana, which can, in, certain doses, induce some paranoia and even hallucinations if the dose is really high, but that would take quite a bit to do.
Right. Or if they're using the wrong strain.
Right.
The sativa tends to be uplifting and can contribute to paranoia and anxiety.
Are there are there any medications that someone's on that is definitely a red flag? It's a contraindication that you wouldn't want to put them on?
Well, I think the medications that I tend to look for are the ones that are suppressive, anti-anxiety, benzodiazepines, I've already mentioned. Usually, Are there any others that you
No, I think Nancy's asking if there would be a contraindication. So if someone was on a benzo, there wouldn't be really a contraindication, I would think. No. But I think just really if someone's on an antipsychotic for an underlying schizophrenic type situation, schizophrenia, I would stay away from it. I don't know of really any other meds that would be an issue. I know that with CBD, it's cleared in the liver by the same enzyme that you see these warnings on certain meds about grapefruit ingestion.
Yes.
Okay, and it's always a funny thing. Patients ask about that. Some of the what we call the statins, or the lipid lowering agents. The reason for that is the enzyme is affected by these products that can raise the levels of those medications. So similarly with CBD, there can be effects on these meds if they have that grapefruit warning. However, is it realistic that they're going to develop toxic levels of these meds? Probably not, but I think that it's worth a conversation before you start it. I suspect since marijuana has CBD in it, that could also be an issue.
Sure.
But it's not something that realistically I think would be a huge issue.
No, I wouldn't expect.
I mean, I recommend CBD all the time to patients who are on Lipitor and these meds, and they do fine, and we talk about it if there's a concern.
How does marijuana work in the body? Like, why is it effective with all the conditions you listed? What does it do?
I don't know. That's
like
way too broad of a
1
question
minute.
Because exactly
1 minute.
There's so many compounds that we've identified, and then compounds that are not yet identified, and terpenes now, and the phytochemicals and cannabidiols, and I don't know that we actually know the mechanisms, right? I mean,
I think it's still being determined. So the main components, obviously, in marijuana are tetrahydrocannabinol, THC, which is the part that I always say to patients to simplify. This is very simplified. That's the part of the plant that can make you high.
Right.
Okay. And then there's cannabidiol, which is CBD. It really has no psychoactive effects. It won't make you high, but it does help with things like pain and issues like that. But then there's a whole host of other phytocannabinoids, so other chemicals in there, more minor components, CBG, et cetera, go on and on. There's a whole bunch of them. And it's not really clear what all of these do exactly. However, we know that they do have effects.
So we don't really know what it does in your brain to make you feel better.
There's a lot of anecdotal data, but like we had mentioned before, there's not a lot of high grade studies that are being done in the U.S.
Sure.
at least, but there are studies that have been done. Then there's something called the entourage effect, which means that you might have a little bit of, let's say, CBG or another phytocannabinoid in there, and it may not be as effective on its own, but then if you put into a person's system in conjunction with CBD or THC, it may be more effective and alter the effect of the other compound that you're using.
Right. Yeah, those other compounds have thought to have anti-inflammatory, anti-neoplastic activity, and so a lot of the studies have suggested I believe there's 70 cannabidiol compounds, and THC is one of the 70.
Yeah.
Right.
I don't know the exact number, but definitely THC and CBD are the main components that we see.
And the 69 may have an effect, but when you add back that one component, THC, it's supposed to have more of a magnifying glass effect on those. But when you get down to the molecular about why it happens, I don't have that information.
All right. And I guess, Courtney, with that, we'll skip to our commercial break, and we'll be back in 30 seconds.
Primacare is Southeastern New England's trusted leader in medical care. With offices in Fall River and surrounding communities, we're dedicated to your well-being. Our carefully selected team of more than 150 providers offers world-class primary and specialty medical care. Primacare doctors are supported by a skilled staff trained to deliver comprehensive radiology, imaging, and testing services. Primacare is large enough to take care of all your medical needs, but small enough to care for you personally. Primacare is by your side.
We're back. Well, thank you everyone for staying tuned in. We're here with Dr. Joseph Spirito. We're talking about medical cannabis, and we were just having a discussion about how cannabis works in the body. And we were saying that there are some unknowns, of course, but and there hasn't been as much research as we need, but definitely research is increasing.
Definitely.
Actually, a lot of research is done in Canada.
Right.
On a lot of these compounds. Interesting. Israel, Europe, there's some too, as I mentioned. So it's getting there. And in the US, we'll have more research. One of the questions that comes up a lot is, and I don't know if you can answer this or not, I have a sense of my belief on it. Is marijuana a gateway drug? Does it lead to other drug use? Because that's always been a concern of the people
Absolutely.
who are, those that are against marijuana usage.
It's a big debate. And I think that can be discussed from a variety of different viewpoints, but one being, and one of the ones I hear quite often, is patients or any individual that's using illicit drugs will often have a history of cannabis use. Sometimes it preceded their history, or it's concomitant. But there's very limited data to suggest that using cannabis by itself will lead to illicit drug use. And so I know there's that debate about was it a gateway, but I don't know that we've actually proven that yet.
Yeah.
What's your belief?
I think that's my general sense too. I don't know that I don't believe it's in most people addictive, and I don't believe that it necessarily leads to other usage. I mean, there's a lot of patients I have that have used, marijuana either recreationally or for medical uses, and I don't see them going to opioids or, other drugs from there. So
I think there's so many other factors that go into that scenario that it's probably just one of the many factors.
Yeah.
Mm-hmm. So what's the advantage of a license? I mean, it's legal in Massachusetts.
Versus just like going into and buying it without a license. Right. Yeah. Well, we already talked about the street part, so we know that. But talk about the rest, Dr. Spirito.
So with the medical license, you you have access to more products.
Oh, you do? Why is that?
I'm not sure, but I think on the recreational side, they wanted to limit the number of products and or potency.
Oh,
I think potency is an issue too. I've heard that with the license, you have access to
higher potency medications, right? There are more legal protections afforded with the license, and I hear this quite a bit from patients that say, "I don't need a license; it's legal." But if you're tested at work, what happens without a license? And then they look at me like, "Oh, no." So I think you have more legal protections with the license. There's no guarantee that your place of employment has to retain you, but at the same time, the state supports your right to work. So It's
Oh,
good to
that's
have a license.
interesting.
I think
And
you have
it's-
to be careful who you work for, though,
Of
too.
course,
If you work for
of
the
course.
federal
The truckers.
government,
Right.
where it's,
Well, that's
you
wouldn't be recommended.
right, you would be in trouble because it's not
Right.
federally legal. Or if you're, like you say, Nancy, you're working as a trucker or somewhere where
Right.
you're driving heavy machinery. This is not something that would be
Absolutely.
advised.
Yep. And it's cheaper. You save taxes. So the medical side is non-taxed. So I think it's 20 or 25% tax.
Yeah, it's up around there. It's a fairly hefty tax.
That is a hefty tax. Wow. So now with you said that I didn't realize it was topical marijuana. What's that used for? Like joint pain and
Well, it's comes in everything: balms, oils, creams.
so it's very
any
similar
types
to
of
the
patches.
CBD products.
Very
I guess.
similar. Only the medical cannabis will have THC or some
Right,
component of
right.
THC added back to
Right.
it for the additive effect. And it's used for cosmetics. It's used for first aid. It can be used for rashes, joint pain.
Huh. And you found it really effective with your patients. They've had
They
good
have,
experiences.
and they've said they've all been anecdotal experiences,
Yeah.
but there hasn't been one patient that has come back and said it absolutely did nothing for me. It
Really?
hasn't happened. So
Yeah, I mean, I use the CBD with patients, and I actually didn't know that there was topical THC CBD products. Because I am more in the CBD space.
Sure.
But I use it when someone has a localized pain condition.
Oh,
So they have osteoarthritis of one knee,
yeah.
right.
or an elbow, or whatever it may be, or shoulder. That's a perfect case use
Mhm.
because they don't need to ingest something systemically that goes throughout their whole system. It's localized to one
Right.
area.
Right.
So
Right.
that's how I think
And the
of it.
THC that's in a topical is not really absorbed by the body, so
Oh, that's interesting.
acts locally.
Now, what about age limits? Like, what are we looking at? Over 18? Over 21?
Right. Well, so to qualify in Massachusetts, you have to be 18 or older. You have to be a resident of the state.
Okay.
You have to establish a relationship with a certified physician and get a written certification that you're eligible to utilize the program. If you're less than 18, you can still get a license. It's not obviously as common. You need parental consent. And depending on the condition, you might need 2 certifying physicians to sign off.
Oh. So, how long does it take? Like, say I see you today and I'm like, I got to do something. I'm not sleeping at night. And you say, okay, bada, bada, bada. How
Mhm.
long from that conversation till I get my hands on a license?
Hours.
Really?
It's that quick.
It's that quick?
Usually it's that quick because
Wow.
what happens is once we've established our relationship and we've done the certification that you have qualifying conditions and you're eligible to use the program, the state's notified that you've been approved. And then you will be emailed essentially an application, or it's really the request that you sign up with the Cannabis Commission in Massachusetts and establish an account.
So, do they track what you're purchasing and stuff like
The
that?
state does, yes.
Okay.
And you establish your account with the Cannabis Commission, and then they will email you a temporary license that you can print out and use that day. It lasts for 2 weeks, and that gives the state the 2 weeks to send you the hard copy in the
So, it's
mail.
almost like the DMV, I guess.
Almost, I
I
guess.
don't know about the DMV.
I don't know. My experience there has been you wait in line for about 6 hours, so I hope it's not the same experience.
You online though, right?
But so if you do see someone, you see a patient, and they get their medical cannabis card, how often do you see them again?
So right now, we only have to see them annually.
Yep.
Some places are recommending a 6-month visit,
Mm-hmm.
and that's worked. And obviously, the patient is able to call and come in anytime they need to. We've always tell them that as well. But usually, it's annually because that medical certification will need to be renewed or each year.
How long do? Oh, never mind.
Oh,
I guess that question was just answered, wasn't it?
No, it's like that ESP thing. So now, with patients that you've dealt with, when you're seeing patients, is there one age group that has a higher use than another age group, or do you get, hey, I want to go try some marijuana?
No, I don't get nervous about that. It's definitely not as common,
Yeah.
but I've had patients over 90 that
Really?
utilize the program. And again, a lot of them will come in and say, I'm not totally naive to this. I've used it before, or a family member's given me some. and they had a positive effect.
Or I used it in the 60s.
Or I used it in the 60s, yeah.
That's because you're old enough that you could have used it.
I was born in the
60s,
60s. I was not old enough to be using it in the 60s.
Just checking.
But I'd say the majority, probably the biggest age group is 20 to 60. I mean, that's a big
age
age
yeah.
group. I mean, but that's where the majority of patients are probably. And surprisingly, more and more patients are coming in because of the chronic pain from degenerative joint disease and neck, low back issues.
Yeah. Were you surprised at first? Like when you were first starting out and getting certified, were you surprised at how effective it really was with the patients that would come back?
Yeah. I have to be honest. Like I said,
Yeah.
I feel like I am doing this not so much because I'm pushing my agenda or my views on it as much as I am helping people use what they're using anyway and getting relief with, but helping them do it legally and safely.
So you were just...
And I just kind of walked into that and said, okay, this, when they came back, how did it work out? My pain's gone. Rash is gone. I've lost weight. I'm not drinking alcohol.
So that's kind of amazing. You've lost weight because you always hear, they get that Twinkie attack at 2 a.m.
Right.
or something.
The munchies.
Right.
Yeah.
I think that tends to be more with the THC heavy products, which, not everyone is using, but it still amazes me and I still don't understand how that could happen. But I had one patient that lost almost 100 pounds.
Oh,
really? Wow.
With a THC rich product?
I don't know what product they were using, but it was after they got their
I
license.
bet that's like complex too, right? They just kind of feel better. Maybe they're doing more stuff.
Right.
Well, there's a whole bunch of stuff that can happen. It can make people lose weight. There's also something called there's some cannabis associated nausea that can occur with, like, very rarely. I've seen it in a few people. These are like people who use a lot of cannabis in general. And they get intractable nausea. So I'm not saying that's why people lose weight using cannabis if they do lose weight, but I've seen that a number of times. And, then you try to get them to cut back, and that's often difficult because they're using it for another reason too. Sometimes it's pain or whatnot. So.
Or sometimes they come in with cyclic vomiting syndrome.
Right, that's basically what I'm talking about.
They want the license because of the
but that's what's giving them the cyclic vomiting. Right, exactly. So true.
So is there a cutoff, like when they have to register and they're like, well, hey, you're using a heck of a lot of this product, and we're gonna kind of say, wait till next month before you can start buying more stuff.
The state allows them 10 ounces per 60-day period.
Okay.
So that's monitored.
I have no idea what that means.
I don't either, but when they walk in, it's recorded, it's monitored, and they're allowed so much. And sometimes patients will go in on their 45th day and be over their limit, and they have to wait. There is a mechanism for them to apply for an increase in that dosage.
So someone like maybe end-stage cancer or something that would need a heavier dosing.
Right.
For our viewers who, maybe have experience with marijuana from 30, 40 years ago, probably useful to point out there's a big difference between the marijuana that's here today versus the marijuana in the 60s and 70s.
Not your grandma's.
Right, it's not your grandma's marijuana.
So what does that mean?
The plant itself has been cultivated to the point where it's producing more THC than it ever had.
It's much stronger.
So it's a lot stronger in the potency of the plant.
Yeah. I mean, there are some, interesting stories out there on social media about misadventures that occur where someone has, for example, a marijuana brownie or cookie, and you're supposed to only have a little piece of it, but they eat, a full brownie or a tray.
Oh, I see.
And then they end up in a situation where they're not psychologically in a good place.
Not getting a therapeutic effect necessarily.
Right.
They go a
2
little
cases.
bit past.
It's like anything. This is a drug that is therapeutic, but if you take too much of it, it can have the opposite effect and not be therapeutic.
Oh my God.
So
what are some of the great stories that you've heard from your patients? Like, has there been a patient that has really struggled with something and you tried like a lot of stuff? And
it goes across all conditions, absolutely positive stories. But the one that really sticks out, and there's been a few with the same diagnosis of agoraphobia. Couldn't leave the house or apartment. They couldn't socialize. They couldn't see anyone. And received their license because they were dragged to get it. And the next time they came in crying, wouldn't let me go, hugging, saying, I have my life back. Not perfect, but I can run errands. I can go to my friend's house. We play cards, 180-degree different.
oh my God.
And honestly, the other condition that responds really well is PTSD, and also the panic attacks, anxiety, and insomnias. But they do extremely well. 180-degree different from the time you first see them to the time they've come back and found that right product.
So that's great that you were such a strong patient advocate for something like this. You know, it's just like you saw what it could mean to your patients.
And
it's
patients, people say, do you believe it? Like, is it actually medical? Is it placebo? How often do you get that question? Is it placebo? Is it real? And plants are medicinal. So I believe that there are compounds and things in it that are medicinal and that we just don't know about yet and that we're researching.
Well, you know, when you think way back in like the 1600s or 1700s, I mean, it was all plant-based.
Right.
And everything.
Cannabis has been used for many, many years. You know, you can go back to Asian cultures and I don't know how many hundreds or thousands of years. I didn't research it, but it's been around for a long time. So I believe it's more than just a placebo effect.
Right.
I don't think that's all the issue. I've had similar stories that it's just the improvement is so striking. It's hard to believe that it's not working. So.
What's the shift been like in the medical community, like among you doctors? Like is it much more accepted now?
For me, it's been much more accepted. I think initially when we started, there was a lot of reservations about it, but now I've had referrals from Mass General and Tufts. And
really,
I think it's more accepted. I still think there are
Right.
people in the traditional medical community that are very leery of it and skeptical, but I think there's much more acceptance. But for those who are skeptical, I would challenge them to do some, to look into it, because these are probably physicians who are also potentially prescribing opioids and benzodiazepines and medications that, although we need to prescribe at times, probably have a lot more potential for harm.
Sure.
Now, is there anything that you want to say to our viewers in like summary on the conversation we just had?
I don't know. I think if they're considering it and have never used it or, have medical conditions that they don't feel they're getting adequate control of, it's an option and you're never really pushed into doing anything. So I'd encourage them just to ask their provider about it and just get more information about it.
Yeah. And I would also add to that, don't use it off the street.
Right.
Because
Absolutely.
It's tainted often with other chemicals, cocaine, etc. And that becomes an issue in its own right, particularly if you're getting drug tested. These are things that you don't want in your system.
Right.
I think just too for the consistency. I mean, if you're buying stuff off the street and you get different product at different times.
To your point, for the classic example of that is patients with anxiety that will buy something off the street that is sativa heavy, and then they get more anxious, and it's a bad encounter. So they'll often say, I'm not interested in trying medical cannabis because I had a bad experience.
Yeah. That's a good point you made up. You made, though, that when someone goes to a dispensary, there's lots of options, and these plants are grown to have different percentages of CBD versus THC versus other agents, phytocannabinoids, etc. So it's not all the same.
Right.
If you get anything on the street, you have no idea what you're getting and what's in it.
Right.
If you go to a dispensary, although you're not meeting with a physician, there are people there who at least are knowledgeable to tell you, to steer you in a particular direction. I still think it requires probably a lot of research for people too.
Definitely.
But it's not like going to a pharmacy where you're speaking with a pharmacist per se,
right?
Who's gone to, who has an advanced degree in this. Although I'm not saying that these aren't knowledgeable people, but I would recommend people do their own research too.
Right. And then on top of it, everyone's different, reacts different too. So.
Right. Exactly.
I never even thought of it like that. Mm-hmm. Like I didn't. That's right, because everyone is growing their own plants, so you're gonna have a little variance with the products in a dispensary.
A lot of these plants have been genetically modified, have been altered over years, and they're made to produce marijuana that has a certain percentage of this component, that component, etc., to have a particular effect.
Right.
So when you go to a dispensary, they can talk to you about that. They can talk to you about, what's the best way to best type to use, what's the best way to use it, is it a gummy, is it a topical,
so then they're probably
etc.
like matching a little bit what you come in with, like if you're like insomnia versus anxiety versus
that's what they
so
should
they
be
can
doing.
kind of like equation based, but like, then this might work for you because it has a little bit more of this and this and this.
I think everyone's experience may obviously differ in that regard, but what normally happens when they go into a dispensary for the first time with the medical license is they'll have an intake there with the provider that's going to ask them what they're looking for relief from, and then they'll steer them into that right product.
Nice.
Yeah.
Right.
Does every dispensary have a provider?
Well, when we say provider, we don't mean like
we
a
need-
physician or a medical
No.
personnel.
But someone very knowledgeable who's on site.
Someone knowledgeable.
More
And I suspect that dispensaries differ in their ability to provide this knowledge. So you may have a different experience with one versus another. They're probably not all the same, just like
Right.
not all restaurants are the same and pharmacies are the same, etc.
Oh, very good. Well, that was very, very knowledgeable. I'm sure our viewers got a lot of good information from that. And how do they get in touch with you if they're interested?
So if they're interested, they can call my office
Okay.
at 508-672-0107, and we'll be happy to talk to them to see if they're a candidate.
Great. And that contact information will be in the show notes for anyone who's listening.
Well, great. This has been a wonderful conversation. Thank you for
Thank you.
coming forward and talking about this with us. It's something I'm personally very interested in for my patients, and it's great to hear the work that you're doing.
Appreciate you having me.
Yeah, no, it's wonderful. And hopefully this will help some patients out there who maybe have been thinking about this as a way to control some of
Sure.
their symptoms that they're concerned about. And I want to thank, of course, Bay Coast Bank. Bay Coast Bank is just right for all your financial needs. Visit baycoast.bank or call 508-678-7641 to learn more. Dr. Spirito, thanks again.
Thank you.
And hopefully we'll have you on again in the future. And if anyone has any questions, you can reach out to us on Facebook, and we'll be glad to follow up on those and send the answers along. Take care, everyone. This is
Thanks.
Chris and Nancy from 27 Degrees Consulting. Have a great day.